Thank you very much, everyone. Thank you very much, everyone. Before I begin, I'd like condolences and best wishes to the people all across our great South, who have endured deadly tornadoes and other severe weather in Texas, Louisiana, Mississippi, Alabama, Florida, Georgia, Tennessee, and South Carolina. My administration will do everything possible to help those communities get back on their feet. We're speaking with the governors and representatives. FEMA's already on its way, and they got there as soon as we heard the word. I said, get out there. So FEMA's there, and you know the great job that FEMA does. It's really something very special. So we just want to say warmest condolences, and we're with you all the way. It's a tough deal. That was a bad level 5. That was a bad group. That's as high as it gets. It's a bad grouping of tornadoes. Something that's something incredible. Power, the horrible, destructive power. America is continuing to make critical progress in our war against the virus. Over the weekend, the number of daily new infections remained flat. Nationwide, flat. The hospitalizations are slowing in hotspots like New York, New Jersey, Michigan, and Louisiana. This is clear evidence that our aggressive strategy to combat the virus is working and that Americans are following the guidelines. It's been incredible what they've done. You looked at the charts, and the charts are, and the models from early on predictions where 100 and 120,000 people looked like if they did well, they were going to unfortunately perish, and we're going to be hopefully way, way below that number. So that will be a sign of people doing things right, but it's still just a horrible thing all over the world. 184 countries. This is all a tribute to our wonderful healthcare advisors and experts who have been with us right from the beginning. We appreciate it so much. In fact, Dr. Fauci's here. Maybe I could ask Tony to say a few words before we go any further. Thank you very much. Tony, please.
Thank you, Mr. President. Just a couple of things, and then I just want to make a comment about something that happened yesterday. You're going to hear from Dr. Birx soon about the numbers that we've been talking about, how things are starting to balance off. And I think the more as we go by each day, I think we're going to see, and again, I never like to get ahead of myself or of Dr. Birx, but it looks like even though we've had a really bad week last week, remember when I was speaking to you before, I was saying this was really a bad week, there's still going to be a lot of deaths, but we're starting to see in some areas now that kind of flattening, particularly in a place that was a hot spot like New York. That's the first thing. The second thing is that I had a really very, very productive conversation with the Congressional Black Caucus this morning for about an hour, and they really wanted to know what exactly are we going to be doing in the immediate as well as the long range about the health disparities and the discrepancies both in infection and in poor outcome in the minorities in general, but specifically African American. And I mean, I made it very clear to them that what we have to do is focus on getting the resources where the vulnerable are, to be able to get testing done, to be able to get the appropriate identification where proper and where appropriate to isolate and contact trace if we can, but also to help mitigate in a community that is suffering and suffering much more disproportionately. So I just wanted to get that out of the way. The other point I wanted to make is that I had an interview yesterday that I was asked a hypothetical question. And hypothetical questions sometimes can get you into some difficulty because it's what would have or could have. The nature of the hypothetical question was if, in fact, we had mitigated earlier, could lives have been saved? And the answer to my question was, as I always do, and I'm doing right now, perfectly honestly say, yes. I mean, obviously, if mitigation helps, I've been up here many times telling you that mitigation works. So if mitigation works and you instigate it and you initiate it earlier, you will probably have saved more lives. If you initiated it later, you probably would have lost more lives. You initiated at a certain time. That was taken as a way that maybe somehow something was at fault here. So let me tell you from my experience, and I can only speak from my own experience, is that we had been talking before any meetings that we had about the pros and the cons, the effectiveness or not of strong mitigations. So discussions were going on mostly among the medical people about what that would mean. The first and only time that Dr. Birx and I went in and formally made a recommendation to the president to actually have a, quote, shutdown in the sense of, not really shutdown, but to really have strong mitigation. We discussed it. Obviously, there would be concern by some that, in fact, that might have some negative consequences. Nonetheless, the president listened to the recommendation and went to the mitigation. The next second time that I went with Dr. Birx into the president and said, 15 days are not enough. We need to go 30 days. Obviously, there were people who had a problem with that because of the potential secondary effects. Nonetheless, at that time, the president went with the health recommendations, and we extended it another 30 days. So I can only tell you what I know and what my recommendations were. But clearly, as happens all the time, there were interpretations of that response to a hypothetical question that I just thought it would be very nice for me to clarify because I didn't have the chance to clarify. Thank you. Excuse me?
The date.
You know, to be honest with you, I don't even remember what the date was. But I can just tell you the first and only time that I went in and said we should do mitigation strongly, the response was yes, we'll do it.
What did you do? Is that the travel restrictions?
No, the travel restriction is separate. That was whether or not we wanted to go into a mitigation stage of 15 days of mitigation. The travel was another recommendation. When we went in and said we probably should be doing that, and the answer was yes. And then another time was we should do it with Europe, and the answer was yes. And the next time we should do it with the UK, and the answer was yes.
Interview, you said there was pushback.
Yeah.
Where did that pushback come
No,
from?
it wasn't, and that was the wrong choice of words. You know what it was? When people discuss, not necessarily in front of the president, when people discuss, they say, well, you know, this is going to have maybe a harmful effect on this or on that. So it was a poor choice of words. There wasn't anybody saying, no, you shouldn't do that.
Are you doing this voluntarily, or did the
No,
president?
I'm doing it. Everything I do is voluntarily, please. Don't even imply that.
So, Mr. President, the question by the way, the travel ban, that was earlier. Travel ban was done earlier. And if you look at statistics, I happen to write a couple of them down. If you look at statistics, so on January 6th, that's long before the dates you're talking about, there were, CDC issued a travel notice for Wuhan, China, a notice, before there was even a confirmed case of the virus in the United States. That's on January 6th. These are all documented because we have so much fake news. I like to document things. January 6th, long before the dates we're talking about, CDC issued travel notice to Wuhan, for Wuhan. On January 11th, we have 0 cases in the United States. 0. We don't have any cases. So there are no cases reported that we know of. This is January 11th. The CDC issued a level 1 travel notice for health, while there were still no confirmed cases. So we had 0 cases. People want me to act. I'm supposed to close down the economy, the greatest economy in the history of the world, and we don't have 1 case confirmed in the United States. That's January 11th. On January 17th, the CDC began implementing public health entry screenings at 3 major U.S. airports that received the greatest volume of passengers from Wuhan at my instructions. There was not a single case of the coronavirus in the United States. So on January 17th, there wasn't a case, and the fake news is saying, oh, he didn't act fast enough. Well, you remember what happened. Because when I did act, I was criticized by Nancy Pelosi, by Sleepy Joe Biden. I was criticized by everybody. In fact, I was called xenophobic. I was asking Biden to please define that for me. I was called other things by Democrats, and some others, not too many others, actually. So that, by the media, definitely. Now, on January 21st, this is long before the time we're talking, because when Tony's talking, I believe he's talking about the end of February. On January 21st, okay, still early, there was 1 case of the virus. At that time, we called it the Wuhan virus, right? Wuhan. There was one case in the whole United States. We had one case. This is all documented. It all comes from you. A lot of it comes from you people. On January 21st, the CDC activated an emergency operations center. There was just one case, one person. That's why that ad was such a phony. There was one person in the United States. You know, they usually there's only one person. That statement was made at that time. One case in the whole United States. One case. I'm supposed to shut down the government, the biggest economy in the history of the world. Shut it down. We have one case. 7 cases were on January 31st. Now, on January 21st, there was a case. Not one person had died. You heard that, Steve, right? Not one person. So we have this massive country, the United States of America. We have the greatest economy in the world, bigger than China's by a lot, right? Because of what we've done over the last 3.5 years, prior to the virus, but including the virus. So we have the biggest economy, the greatest economy we've ever had, the highest employment numbers, the best employment numbers, best unemployment numbers also, the best of everything. So on January 31st, think of it, not one person has died. Not one. Nobody died. Not one, John. I don't think you'll find any. This is reported by CDC, confirmed by the news, which doesn't mean anything to me because they don't tell the truth. But CDC reported January 31st, not one person has died, and I issued a travel restriction from China. Think of it. So nobody died, and I issued. You can't get earlier than that. So we have nobody died, and I said, China, you can't come in. I'm sorry. Because I saw what was going on. It wasn't so much what I was told. It was that I saw what was going on. And I didn't like it. But I didn't speak to Tony about it, didn't speak to very many people about it. I didn't like it. So what did I do? Ready? January 31st, in the United States, not one person had died because of the Wuhan virus. So I issued travel restrictions on that date, even though nobody died, and I got brutalized over it by the press because I was way too early. I shouldn't have done it. Brutalized by the press. But, you know, sort of I've been brutalized for the last 4 years. I used to do well before I decided to run for politics. But I guess I'm doing okay because, to the best of my knowledge, I'm the President of the United States, despite the things that are said. So then, first mandatory quarantine in more than 50 years, we did. First mandatory in 50 years. The same restrictions that the Democrats and the media call xenophobic. Now, Joe Biden said he's a racist. He called me a racist because I said we're shutting down entry from China. We're shutting it down. He called me xenophobic and he called me a racist and other things. Since then, on a Friday night 2 weeks ago, Joe Biden issued a statement. It wasn't him, he didn't write it. I'm sure he doesn't even know that it was issued. But the people from his campaign, who are smart, people that write these little PR releases are pretty smart, reasonably good, not the best, but they're not bad. But they issued a statement saying that Joe Biden agrees that that President Trump was right to close it down to China. Now, he did that. Now, he issued it on Friday night. We've all heard about that, John, Friday nights, right? In fact, his was later Friday night than I ever released mine on Friday nights. Okay? So he did it pretty late. I mean, you know, like at 11 o'clock in the evening or something. You know, it's pretty late. Anyway, so Joe Biden issued, and it's one of those things. But in February, Nancy Pelosi said we should come to Chinatown. This is late February. Come to Chinatown. We think it's very safe. Come here. Let's all have the big parade, Chinatown parade. Probably referring to San Francisco. And that's it. But I took this action early. And so the story in the New York Times was a total fake. It's a fake newspaper, and they write fake stories. And someday, hopefully in 5 years when I'm not here, those papers are all going out of business because nobody's going to want to read them. But now they like them because they write about me. Now with that, I have a couple of interesting, we have a few clips that we're just going to put up. We can turn the lights a little bit lower. I think you'll find them interesting. And then we'll answer some questions. I'll ask you some questions because you're so guilty, but forget it. But most importantly, we're going to get back onto the reason we're here, which is the success we're having, okay? Please, you can put it on.
People should be more concerned right now with the flu in this country.
A lot of people are concerned about the coronavirus because they're hearing a lot of news about it right now. But the reality is, comparing it to the flu, for example, it's not even close to being at that stage.
What if it is worse? Is this a moment where maybe countries put politics aside, a little bit of pride aside, and do we have U.S. officials, should U.S. professionals such as yourself get involved?
How worried should Americans be about coronavirus?
Coronavirus is not going to cause a major issue in the United States.
Well, we've asked them to accelerate whatever they're doing in terms of a vaccine.
We will be suspending all travel from Europe to the United States for the next 30 days. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Medicare patients can now visit any doctor by phone or video conference at no additional cost.
The first 1 million masks will be available immediately.
As there were more cases, and it was clear that it was spreading out of China, where it originated, the president took this move that he was widely criticized for by Democrats and even some Republicans at the time, which was he halted a number of flights from China.
Tengo un grupo particular que le estoy dando clases. Entonces todos los días tengo yo clase. Todos los días hablo de 3 a 4 horas. Todos los días. Entonces por eso. ¿Ustedes notan cansancio en la garganta? No, sí. Sí estoy cansado. Azotado. Qué chasco. Y así lo tiene la humanidad, ¿sabes? La mayoría de la humanidad piensa que Dios castigó a